This is the part 2 video of vertical jaw relation. Let us start with how to determine vertical dimension at occlusion. There are two main methods to see, physiological methods and mechanical methods. In the physiological method, the first method is being the Niswonger's method. Niswonger suggested that vertical dimension at occlusion, VD at occlusion, is nothing but vertical dimension at rest minus the freeway space. For this method, we should determine the vertical dimension at rest using any one of the method we discussed in the previous video. And we should also know the concept of freeway space. If you have not checked out previous video, please check it out. So after determining the vertical dimension at rest using any one of the method to determine VD at occlusion follows. The maxillary occlusal rim, which has been already oriented to the cranium, that is the orientation jaw relation, has been established either using Fox plane or face bow. Then the maxillary occlusal rim is inserted, followed by the mandibular occlusal rim. The maxillary occlusal rim should not be adjusted. The mandibular occlusal rim is adjusted such that the maxillary and the mandibular occlusal rim come in contact evenly, and when they contact, the facial measurement is 2 to 4 mm minus the vertical dimension at rest, which we determined before. That is, vertical dimension at occlusion is established when the maxillary and the mandibular occlusal rim are in contact. This is determining VD at occlusion by Niswonger's method. Let us see the next method, which is by swallowing threshold. This method is not proved to be consistent, therefore let us see the concept alone. This is based on the concept that at the beginning of a swallowing cycle, the maxillary and the mandibular teeth come in contact. Therefore, we should record the dimension when the swallowing cycle starts. To initiate swallowing cycle, saliva is stimulated either using chocolate or a candy, and the patient is asked to repeatedly swallow. The lower occlusal rim is made of soft wax and is softened just before initiating swallowing cycles. On repeating the swallowing cycles, the softened lower occlusal rim is reduced until the vertical dimension at occlusion is established. The next method is using the phonetics, which is an important method. It is based on the concept of closest speaking space given by Dr. Silverman. He defined closest speaking space as the closest relationship of the occlusal surfaces and the incisal edges of the mandibular teeth to the maxillary teeth during function and rapid speech. When the patient repeats words containing letter S or sounds like itch and idge, the gap between the upper and the lower occlusal rim should be 1 to 2 mm, which is the closest speaking space. If the gap is more than that, then the vertical dimension at occlusion is very small and has to be increased. But if the occlusal rims come in contact while pronouncing the sounds, that means vertical dimension at occlusion has been too much and should be reduced. The next method uses the neuromuscular perception. Two devices are used. In the first method, we use a device called as central bearing device, which consists of a central bearing screw and a central bearing plate. The screw is adjustable. Initially, the screw is placed such that the vertical dimension is increased, and it is gradually adjusted such that the vertical dimension is reduced till the patient feels overclosing or comfortable. In another method, which was suggested by Booth in 1940, we use a device called as bimeter. Booth suggested that the maximum biting force in an individual is registered at vertical dimension at rest. This bimeter registers the maximum biting point. This point is also known as the power point, and therefore Booth suggested that vertical dimension of occlusion can be calculated by minusing 2 mm from the rest position. Final method in the physiological method of determining VD at occlusion is usage of aesthetics. When VD is increased, the skin of the lips appears stretched. When VD is decreased, the skin appears flaccid. The labial contour can also be checked by an experienced dentist. We next move on to the second method, that is the mechanical methods for determining vertical dimension at occlusion. We can use either ridge relations or pre-extraction records. In ridge relations, we can either check the distance between incisive papilla to the mandibular incisors. It should be 4 mm in centric occlusion. And in ridge parallelism, we could check the parallelism between the maxillary and the mandibular ridges when there is a 5-degree opening in the posterior region. Regarding the usage of pre-extraction records, we could either use profile photographs or profile silhouettes. Profile photographs which were taken before extraction could be compared to the photographs which are taken after the vertical dimension established occlusal rims inserted in the patient's mouth. Profile silhouettes are of similar use. Silhouettes are carved out in cardboard and cutted and contoured with wire and can be used for reference. Similarly, radiographs and articulated cast facial measurements which were done before extraction of the teeth could be compared with those which will be taken after the establishment of vertical relation. Measurement of former dentures can be suggested as a method, but it cannot be appropriate always. Let us see certain effects. What will happen if there is an increase or decrease in vertical dimension? There could be discomfort when vertical dimension is increased because patient needs to put some effort to chew in condition where the vertical dimension is increased rather than the old natural environment where vertical dimension was normal. In case of when vertical dimension is decreased, there is inefficiency in chewing because the biting force exerted by the teeth will be obviously decreased. In cases of increased vertical dimension, there is trauma to the denture bearing area due to constant clicking or contacting of the teeth, whereas cheek biting is seen in decreased vertical dimension due to loss of muscle tone and flabby cheeks. There is TMJ problem and facial distortion in both the cases, and there is also clicking of teeth and muscular fatigue which is seen in cases of increased vertical dimension.